I am Dr. Albert Nwaba, Medical Director at the Tasmanian Digestive Centre. Today I'll be talking about bowel cancer and the National Bowel Cancer Screening Program in Australia. Bowel cancer is one of the most common cancers in Australia. Amongst men, is the third leading cause of cancers and second leading cause of mortality amongst men in Australia. It arises from the inner lining of the bowel and usually start as a growth, which are polyps. And if not removed, polyps could eventually result into bowel cancers. In terms of presentation, it could present in three different forms. Firstly, it could come without symptoms. And usually it is detected whilst patients are enrolled in a screening program. The symptoms would include bleeding from perectum, which is passage of blood in the rectum, abdominal discomfort, significant weight loss, iron deficiency anemia, or altered bowel habits. The third presentation could be when patients present with intestinal obstruction that often results in emergency department. Of these three different presentations, the most common would be when patients present with symptoms. The diagnosis usually could be suggestive from initial screening, from a CT scan, which could raise concerns about lesions found. But the definitive diagnosis is confirmed from a colonoscopy. In terms of treatment, usually surgical resection would be the first line of treatment, but there are other modalities of treatment like chemotherapy or radiotherapy, depending on the stage of the disease. It is very important that this is detected early, hence why I will be talking briefly about the National Bowel Cancer Screening Program. We do know that with early detection, when it's detected at stage 1, you do have over 90% chance of cure. And in terms of survival, it's over 90% over 5 years. However, if it is detected late, which is stage 4, the survival drops down to 15% over 5 years. Hence, the need for increased uptake in the National Bowel Cancer Screening Program. We also know that in Australia, 1 in 15 Australians over their lifetime will have bowel cancer. And there are 16,000 detected cases annually in Australia of bowel cancer. Most cases tend to occur over the age of 50 years. The National Bowel Cancer Screening Program aims to enroll people between the ages of 45 to 75 with the sole aim of detecting this quite early. Unfortunately, we do not have a significant uptake, and there's a significant disparity amongst male and female when it comes to uptake. From the data we know in Australia, about 38% of male have embraced this, while 44% of female have been enrolled in this program. It is initially with a fecal immunohistochemical test, which is the fecal occult blood testing. And if positive, you are then enrolled into a program where you then have a colonoscopy. You are oftentimes referred by the general practitioner to the gastroenterologist, and it is usually triaged as category 1 with the aim that you should have your procedure within 4 weeks. And in terms of treatment, we also aim that within 6 weeks, you should have had treatment.